I'm going to teach you how you can determine the patient neck condition at this time. We're doing the passive range of motion or active range of motion to determine the patient condition. We're going to bend forward the patient neck forward and backward and chin down and turn left and turn right and do lateral flexion and other side. After the passive range of motion test, we're doing the active range of motion test. Bend forward as much as you can. Okay, and raise up. And chin down, turn. Okay, turn. Okay, do lateral flexion to the left. Okay, to right. Most of the active range of motion or passive range of motion, you can determine his joint motion and muscle reaction too. And you can find what kind of pain pattern he has. At this time, so we're going to do joint mobilization, palpate at the cervical spine and the individual joint and how is the joint motion is going through. Most of chiropractors and physical therapists, they do adjustment or joint mobilization. We're doing the joint mobilization to find which joint has a problem as restricted motion or pain is promoted. That's why we're doing that adjustment or joint mobilization to increase their joint motion. After adjustment or joint mobilization, what you're going to do? We create a better curve of the spine, but your patient doesn't know how can move their muscle on their better curve. That's why we designed the Pillow 1 to 3 or Pillow 1 to 3 Plus to educate your patient's muscle on the better curve. I'm gonna teach you how can use the Pillow 1 to 3 Plus for your patient. Earlier you checked your patient's neck range of motion and joint motion. However, you might have to check your patient neck motion again because when you use Pillow 1 to 3, you can see that the round shape on the headpiece that's gonna support your patient's neck curve. First, I'm gonna use the pillow headpiece only without rod, no panels. Your patient head up and then put the Pillow 1 to 3 all the way in and lay down on there. And ask to your patient how he's feeling. When your patient lay down on the pillow headpiece, sometimes your patient has a neck pain or he doesn't have a pain. That you have to determine his joint motion stability, like a cervical spine curve. When using the joint mobilization or adjustment, we create a C curve. If he has a pain already on this posture, his cervical spine is not good. That means his C curve is not enough. You might have to joint mobilize on his cervical spine or adjustment on the cervical spine. If your patient is fine on this posture, what you're gonna do? You're gonna do suboccipital flexion or extension or cervical flexion or extension first. For me, I'm gonna do the suboccipital flexion extension first. First of all, your patient bring it down chin and ask to his pain or raise up all the way and he has a pain or not. When he's doing that motion and he has a pain, his joint is unstable. At these times, might be you have to adjust or do joint mobilization on the cervical spine. And then also you check the rotation or lateral flexion is possible. Rotation is more important than lateral flexion. First, you're gonna check the head back a little bit and turn to left or turn to right. If your patient has pain at this time, this support is too high, so you need to adjust or joint mobilization for this patient. If your patient do not have the pain, then you might change to the firmness of Pillow 1 to 3 Plus. There is 3 different rods, that's soft to firm. I'm gonna use that yellow, medium firmness. And patient head up, I put the inside of there. And same thing, you're gonna lay down. If you ask the question, your patient, how does it feel? Then your patient gonna be say, that's firmer than before. That means that more stable motion you can promote when you do that range of motion. So we're gonna do the same motion thing. First, chin down and all the way extended. And might be he has a pain or not. And turn to left and turn to right. So this kind of support is fine. Then next one, what we're gonna do that I'm gonna raise a little bit more, like use the panel and attach on the pillow 1 to 3. Without load first, and do that, chin up, and chin down. And check the motion, and then a little bit chin up, do that kind of support. You can see that's the cervical spine, C-curve, and turn to left, and turn to right. So if he has a pain at these times, we have to do joint adjust or joint mobilization technique to improve his neck joint motion.